Understanding cyclothymic disorder. A deep dive into mood fluctuations. Have you ever felt like you were on an emotional roller coaster, with your moods swinging up and down? For some, these fluctuations are more than just everyday ups and downs. In this video, we'll delve into the complexities of this condition, exploring its symptoms, causes, and most importantly, how it can be effectively managed. Cyclothymia is characterized by chronic mood fluctuations that interweave periods of hypomanic symptoms with periods of mild, depressive symptoms. These swings happen over an extended period, at least 2 years for adults and 1 year for children and adolescents. They can feel like being on a constant seesaw, never quite reaching the highs of mania or the lows of major depression, but still significantly impacting daily life. Relationships may suffer as loved ones struggle to cope with the changing moods. Work or academic performance might be affected by fluctuating energy levels and motivation. By understanding the nature of these chronic mood fluctuations, we can begin to address the challenges they present and work towards creating a more balanced and fulfilling life. Let's shed some light on the upside of cyclothymic mood swings, hypomania. During a hypomanic episode, you might notice a surge of energy, feeling like you can conquer the world. Your mind might race with ideas, and you might find yourself talking more quickly than usual. This surge in energy and enthusiasm can be intoxicating. You might find yourself taking on multiple projects at once, feeling confident in your ability to handle it all. However, this heightened state can also have its downsides, leading to restlessness and agitation. Understanding the nuances of hypomania, both the exhilarating highs and potential pitfalls, is crucial for effectively managing cyclothymia. Just as understanding hypomania is crucial, so too is recognizing the depressive side of cyclothymic mood swings. When depression sets in, you might find yourself grappling with feelings of sadness, hopelessness, or emptiness. Fatigue can become a constant companion, making it a struggle to muster the energy for even simple tasks. Concentration might waver, making it challenging to focus on work, studies, or even conversations. It is crucial to remember that even though these depressive symptoms are milder than those of major depression, they are not insignificant. Recognizing these symptoms and seeking support when they arise is essential for effectively managing cyclothymia and minimizing the impact of depressive episodes. While it involves experiencing both hypomanic and depressive symptoms, it's crucial to understand that these symptoms don't quite reach the level of a full-blown manic, hypomanic, or major depressive episode. This distinction is a key factor in diagnosing cyclothymia, setting it apart from bipolar I or II disorder. Cyclothymia exists in that space where mood swings are noticeable and impactful, but don't quite cross the threshold into the full-blown episodes seen in other bipolar disorders. This can sometimes make diagnosis more challenging, as the symptoms might be mistaken for personality traits or simply brushed off as moodiness. However, this distinction is crucial for ensuring that individuals receive the appropriate treatment and support tailored to their specific needs. Imagine a pendulum swinging back and forth, never quite finding a resting point. This constant motion captures the essence of cyclothymia, where mood swings are frequent and persistent, rarely providing extended periods of stability. These frequent fluctuations can make it challenging to establish a consistent routine or maintain a sense of normalcy. One day you might feel energized and productive, tackling your to-do list with gusto. The next, you might find yourself struggling to get out of bed, overwhelmed by fatigue and low mood. Understanding the cyclical nature of cyclothymia is crucial for developing coping mechanisms and seeking support to navigate these fluctuations more effectively. For adults, A diagnosis of cyclothymia requires at least 2 years of these ups and downs, with symptoms present for at least half of that time and no symptom-free period exceeding 2 months. For children and adolescents, the timeline is slightly shorter, requiring at least 1 year of persistent mood swings. This difference acknowledges that mood regulation systems are still developing during childhood and adolescence, making it important to identify and address potential concerns early on. This emphasis on duration highlights the chronic nature of cyclothymia, setting it apart from more transient mood changes that might be triggered by specific events or stresses. Cyclothymia is more than just experiencing mood swings. It's about how these fluctuations impact your ability to function in your daily life. Relationships often bear the brunt of these challenges. The highs and lows of cyclothymia can be confusing and frustrating for loved ones, leading to misunderstandings and strained connections. Work or academic performance can also be significantly impacted. The fluctuating energy levels and motivation associated with cyclothymia can make it difficult to maintain consistent productivity. Tasks that once seemed manageable might feel overwhelming during depressive periods, while hypomanic episodes might lead to impulsivity and difficulty focusing on long-term goals. Maintaining stable relationships requires open communication, empathy, and a willingness to understand and support one another through the ups and downs. Cyclothymia often emerges during adolescence or early adulthood, a time of significant change and development. During these formative years, the brain is still developing, making it more vulnerable to the disruptions caused by mood disorders. Early identification and intervention are crucial for mitigating the potential long-term consequences of cyclothymia, allowing individuals to develop healthy coping mechanisms and build a strong foundation for managing their condition. Early intervention for cyclothymia can help prevent the condition from taking root and impacting various aspects of a young person's life. Is cyclothymia etched into our DNA or shaped by our experiences? This question of nature versus nurture has long intrigued researchers studying mood disorders. While there's no single gene for cyclothymia, evidence suggests that genetics do play a role. If you have a family history of bipolar disorder, particularly among close relatives like parents or siblings, your chances of developing cyclothymia might be higher than someone without the genetic background. However, genes are only part of the story. Environmental factors such as stressful life events, trauma, or substance abuse can also contribute to the development of cyclothymia. It's the complex interplay of these genetic and environmental influences that ultimately shapes an individual's experience with the condition. Cyclothymia often co-occurs with other mental health concerns, adding another layer of complexity to diagnosis and treatment. Anxiety disorders are frequent companions to cyclothymia, with individuals experiencing excessive worry, fear, and restlessness. Substance use disorders are another common comorbidity, as individuals might turn to drugs or alcohol as a way to self-medicate or cope with the emotional distress caused by cyclothymia. A holistic approach that considers all co-occurring conditions is essential for providing effective and personalized treatment. Why do some individuals develop cyclothymia while others don't? This question has puzzled researchers for years as they try to unravel the complex web of factors that contribute to this mood disorder. Stressful life events, such as the death of a loved one, a job loss, or a major illness, can also trigger or exacerbate cyclothymia. For some individuals, the added stress of these life events might push them over the edge, triggering the onset of mood swings. Understanding these risk factors can help in developing strategies to manage and mitigate the impact of cyclothymia. Living with cyclothymia can feel like navigating a ship through choppy waters, but with the right tools and support, you can chart a course towards calmer seas. Psychotherapy, particularly cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, has proven effective in helping individuals with cyclothymia understand and manage their mood swings. Medications, such as mood stabilizers or antidepressants, might also be recommended to help regulate mood and reduce the severity of symptoms. These medications work by adjusting brain chemistry, helping to stabilize the neurotransmitters that influence mood and emotional regulation. However, finding the right medication and dosage is often a process of trial and error, requiring close collaboration with a healthcare professional. We've covered a lot of ground in this video, exploring the intricacies of cyclothymic disorder, from its symptoms and causes to its impact on daily life, and the importance of seeking help. If you found this video helpful, please give it a thumbs up, share it with anyone who might benefit from this information, and subscribe to our channel for more valuable content on mental health and well-being. Your engagement helps us bring more valuable content to you.